AAMC just saw this growing, looming shortage of physicians. Georgia was no different, and although they had, several medical schools, they really charged the entire United States to expand medical education at the student level. That's where really the partnership was born out of. You've got the flagship here at UGA, the flagship medical school in the state, and they came together and said, wow, let's build something amazing together in Athens and then put 40 additional students there.
I really like the curriculum at this campus, and so that's the main reason why I chose here. I found in undergrad that I did really well in settings that were smaller student-to-faculty ratios. So the smaller class size and small group-based learning were really important to me. I'd say I probably learned 25% at least of the curriculum from my peers.
Each week has a weekly theme, so the week's cases for small group learning and the week's large group presentations, laboratories, lectures, and other things all connect to that weekly theme. The case material for small group learning is authentic cases, real patients that either I or other faculty have had, and they're edited in such a way to unfold over the week and allow multi-stage learning.
Well, during small group, we usually had a one patient case or two patient cases, and we would, evaluate the patients, so look into their history, look into their problems, and do our research based on their history. So when in the hospital and in outpatient clinic, you have a patient, you're wondering what they have, so you're doing that same exact research. You're going through the motions that we went through in small group, looking at their history, parsing out all those details, and trying to find how you can help them and try to figure out what's going on.
The medical students work directly with me in patient interactions, as well as going in beforehand and getting the initial evaluation and then coming back and reporting to me. The main reason I wanted to volunteer was to be exposed to new learners, young learners, and have the opportunity to participate in their education.
Well, it's been a lot of one-on-one time. With the OBGYN, I helped deliver twins, which was amazing. It was something I never thought I'd be doing. With the pediatric cardiologist, helped diagnose hypertrophic cardiomyopathy. So really the one-on-one experience is really incredible.
You're working with a resident and then you're attending. So you do get to learn a lot, and you get a lot of feedback. So when you're giving presentations, your attending can tell you right there how you're doing. And because they're working so closely with you, there's a lot of opportunity for improvement, and they notice it.
Working with medical students is incredibly energizing. It helps to question the things that you think that you understand and know, and helps you to view things from different perspectives. I think it's a fantastic opportunity for the students to work directly with the clinicians. Athens is a fantastically vibrant clinical and academic community. So it's a nice mix of a small feeling town with that sense of community, but also a tertiary referral center and really interacting with state-of-the-art care.
It's just been amazing. And our two area hospitals, St. Mary's Healthcare and now Piedmont Athens Regional, have been critical to the learning environment here for the students.
Overall, I think the medical partnership has really raised the level of medical care that's provided in our area. It has brought in lots of experts, whether it's from basic science and research to clinical practitioners from around the country who trained at excellent institutions and can bring their expertise to the area and care for our patients.
We want to have excellent trained physicians at the end of this. I mean, that's the ultimate goal. I think the second goal is we want to keep them here in Georgia to practice. That was the main mission of the campus. Main mission of MCG is the public medical school. Research, we definitely want to continue with hires like Matt Krim and others in collaboration with UGA and Augusta to build on that research program. We'd like to have the students better equipped for 21st century practice, so introduction of technology, basic concepts on population health and informatics, I think is critical. And then last but not least is team learning. I mean, you've got to learn how to work in teams to deliver health care.